Lupus is an autoimmune disease, which means that your antibodies see your own healthy cells as foreign objects and attack them, causing inflammation and damage. Lupus can affect many parts of the body, including the joints, skin, kidneys, lungs, blood vessels, and brain. Although people with the disease may have different symptoms, some of the most common ones include extreme fatigue, arthritis, unexplained fever, skin rashes, and kidney problems. There are several different types of lupus, with the most common form being systemic lupus erythematosus, or SLE. Although SLE usually develops in people between the ages of 15 and 44, it can occur later in life also. The signs of SLE vary, and there are usually periods of illness and wellness. Let's cut that one out. Okay. Some people have just a few signs of the disease, and some of these symptoms include butterfly rashes across the nose and cheeks, skin rashes on portions of the skin exposed to the sun, sores in the mouth or nose, painful or swollen joints, fever, weight loss, hair loss, fatigue, chest pain when taking deep breaths, purple or pale fingers or toes from cold or stress, abdominal pain, kidney inflammation, headaches, paranoia, schizophrenia, hallucinations, depression, trouble thinking, memory problems, seizures, strokes, and blood clots. Another less common form of lupus is discoid lupus erythematosus, which causes a skin rash which does not go away. Another form of lupus is subaculate cutaneous lupus erythematosus is subacute. Another form of lupus is subacute cutaneous lupus erythematosus, which causes skin rashes on parts of the body exposed to sunlight. Another form of lupus is drug-induced lupus, Another form of lupus is drug-induced lupus, which is very similar to SLE, except it is caused by long-term Another form of lupus is drug-induced lupus, which is very similar to SLE, except it is caused by long-term exposure to prescription drugs. The last form of lupus is neonatal lupus, which is very rare, but it occurs in babies of women who have SLE, and the babies have heart defects as a result. Lupus affects many people with no definitive number, but studies have found it from anywhere from very conservatively 2,390 people. Lupus affects many people. Lupus affects many people with no definitive number, but studies have found it from anywhere from 239,000 to 1.5 million people in the United States. About 9 out of 10 people who have lupus are women, and about 1/3 of these are women of African or Hispanic descent. Between 1979 and 1998, the annual number of deaths from lupus rose from 879 to 1,406, and the crude death rate rose from 39 to 52 per million population, with a total of 22,861 deaths reported during this 20-year period. And so many people are not killed by lupus. However, they are forced to struggle with the disease for their entire lives. The reason that lupus needs funding in order to promote more research is because we are unable to determine whether the reason that lupus needs funding in order to promote more research is because we are unable to even determine the cause of lupus. We are unsure whether it is environmental, genetic, hormonal, or bacterial. Additionally, it can take months or years to even diagnose a patient with lupus, and we are unable to currently treat lupus itself. We are only able to treat its symptoms. And so we are asking for $100 million in order to promote research for development and And so we are asking for $100 million in order to promote research for the diagnosing and treatment. Okay. And we are asking for $100 million in order to promote the treatment and diagnosis of lupus.